Welcome to Study Nurse IQ's comprehensive guide to perioperative nursing care. Today, we'll explore the critical aspects of perioperative nursing care, a fundamental component of surgical patient management. In this lesson, we'll cover the essential phases of care: preoperative, intraoperative, and postoperative. Understanding these phases is crucial for providing optimal patient outcomes and ensuring safe, effective surgical experiences. Let's begin with preoperative care, a phase that sets the foundation for successful surgical outcomes. Perioperative care literally means everything that happens around a surgery. It's broken down into 3 phases: pre-op, intra-op, and post-op. On the day of surgery, your main job is to ensure the patient is ready. The most crucial part: informed consent. It's a legal and ethical requirement that the patient understands the procedure, risks, and alternatives. As a nurse, you may witness the patient signing the consent form, but it's vital to remember that you do not answer questions about the procedure itself. That is the provider's job. If your patient has any questions, you must call the surgeon to come and answer them. This is a key safety point that you'll be tested on. Intraoperative care, the OR. Now, let's move into the operating room, or intraoperative care. Here, patient safety is paramount. One of the most important protocols is the timeout procedure. Just like in sports, everybody literally stops what they're doing. The entire interdisciplinary team, nurses, doctors, and anyone else, pauses to verify key information. This includes confirming the correct patient, the correct surgical site, which should already be marked, the correct procedure, and any allergies. The timeout is the final safety check to ensure everyone is on the same page before the surgery begins. Post-anesthesia care unit. After the surgery, your patient heads to the PACU, or the post-anesthesia care unit. This is the immediate recovery phase, where your assessments are rapid and frequent. Your top priorities here are: respiratory status. Anesthesia can depress a patient's breathing. You'll need to frequently assess their respiratory rate, depth, and oxygen saturation. Be prepared to administer antidotes like naloxone for opioids or flumazenil for benzodiazepines if needed. Vital signs. You'll check vital signs every 5 to 15 minutes, much more frequently than on a regular floor. We're looking for any signs of hemorrhage or shock, such as a drop in blood pressure or an increase in heart rate. Airway protection. Make sure the patient stays NPO, nothing by mouth, until their gag reflex returns. This protects their airway and prevents aspiration. Thermoregulation. Patients often feel cold after surgery. Provide warm blankets to prevent hypothermia and keep them comfortable. Ongoing postoperative care. Once your patient is stable, they'll be transferred to a general nursing unit for ongoing post-op care. While the immediate threats are reduced, we must still be vigilant for complications. Key nursing interventions include hemorrhage and shock. This remains a major threat. Be on the lookout for signs like changes in vital signs, pale skin, diaphoresis, sweating, or an altered level of consciousness. DVT prevention. Encourage early ambulation and use sequential compression devices, SCDs, or anti-embolism stockings to prevent blood clots. Pulmonary hygiene. Continue to encourage the patient to use the incentive spirometer and to cough and deep breathe. This helps prevent atelectasis and pneumonia. Infection monitoring. Anytime the body is surgically entered, there is a risk of infection. Monitor the patient's temperature and heart rate for increases and assess the surgical site for any signs of infection like redness, swelling, foul-smelling drainage, or purulent fluid. By staying on top of these key points, you'll be providing safe and effective care throughout the entire perioperative period. NCLEX-style questions. All right, let's test your knowledge with 3 NCLEX-style questions. Question 1. A nurse is acting as a witness for a patient's surgical informed consent. The patient states, "I'm still not sure I understand exactly how the surgeon is going to perform the procedure." What is the nurse's most appropriate action? A. Explain the procedure to the patient in simple terms. B. Encourage the patient to sign the consent form and trust the surgeon. C. Contact the surgeon to come and answer the patient's questions. D. Inform the patient that it is a common procedure and they have nothing to worry about. Correct answer, C. Contact the surgeon to come and answer the patient's questions. Rationale: a nurse's role in informed consent is to act as a witness, not to explain the surgical procedure. The provider performing the procedure is responsible for ensuring the patient fully understands it. If the patient has questions, the nurse must call the provider to address them before the consent is signed. Question 2. A patient is being transferred from the OR to the PACU. Which nursing action is the highest priority upon the patient's arrival? A. Checking the surgical site for drainage. B. Administering a warm blanket. C. Assessing the patient's respiratory status. D. Checking the patient's blood pressure and heart rate. Correct answer C. Assessing the patient's respiratory status. Rationale: the highest priority in the PACU is always the patient's airway and breathing. Anesthesia can depress respiratory function, so the nurse must first ensure the patient has a patent airway and is breathing adequately before moving on to other assessments. Question 3. A nurse on the medical surgical unit is caring for a patient on their second postoperative day. The nurse notices the patient's oral temperature is 101.5 degrees Fahrenheit, 38.6 degrees Celsius, and their heart rate is 110 BPM. The nurse should first assess for which of the following complications: A. Hemorrhage, B. Aspiration, C. DVT, D. Infection. The correct answer is D. Infection. Rationale: while hemorrhage can cause an increased heart rate, the presence of a fever in a post-operative patient who is no longer in the immediate recovery phase is a primary indicator of infection. Aspiration is more likely to occur in the immediate post-op period. A DVT would present with symptoms like calf pain, swelling, and redness. That's your essential guide to perioperative nursing care. If you found this video helpful, please give it a thumbs up and subscribe to our channel. Thanks for watching.